All right, welcome back. It's time to start getting into the care portion of the class, which everyone tends to get excited about. So we're going to first start off by addressing Chapter 3, which is talking about cardiac emergencies. And when we think about cardiac emergencies, often we think about CPR. The objectives of this chapter will be to understand causes of cardiac emergencies, understand the basic first aid for a heart attack as well as cardiac arrest, understand what CPR is and how to administer CPR to adults, children, and infants, understand what an AED is and how to use an AED, understand how to handle and adapt to special situations that might arise during the administration of CPR and or the use of an AED. So cardiac emergencies. Cardiac emergencies are life-threatening emergencies, and often they can hit close to home. You may have had a family member who has suffered from a heart attack. You may have had a family member who's passed away from a cardiac emergency. You may know someone close, like a friend or a coworker, who has also experienced this. Unfortunately, it is one of the most common emergencies you are going to experience at some point in your life and come into contact with. So it's really important to make sure that you understand the signs and symptoms, being aware of how to identify someone is suffering from a cardiac emergency. Knowing this can make a big difference between the person's chance of survival. Because every minute counts in the survival, it often depends on someone as a first responder or a lay responder to respond very quickly. For every minute the person that is suffering from cardiac arrest goes without care, the chance of survival goes down by 10%. That's a significant amount of time. If you think about 10 minutes go by, this person's chance of survival has gone down by 100%. So it really kind of puts it in perspective of how every second and how every minute really counts when it comes to recognizing and responding to a cardiac emergency. The two that we're going to talk about are heart attacks as well as cardiac arrest, and they are two different things. Heart attacks occur when oxygenated blood that feeds the heart tissue is blocked, causing that heart tissue to die. The blockage is commonly referred to as coronary artery disease because the coronary arteries are the vessels that are feeding the heart tissue. Now, I understand this is not an anatomy class. Some of you may have had anatomy in the past, so you might know what I'm referring to. But those of you that don't know and have never heard of the coronary arteries, they are the arteries that actually feed the heart tissue with the blood that carries nutrients and oxygen that it needs. So you can imagine if those arteries carrying that oxygenated, nutrient-rich blood are blocked, that blockage is going to adversely affect the heart tissue. So when these arteries have buildup in them, the blockage is formed, and this restricts the amount of blood flow, depriving the heart of oxygen. The cells that these vessels feed will ultimately die, resulting in a heart attack. What do you think can cause you to develop coronary artery disease? And have you ever heard of PHED? So often we think of people developing coronary artery disease from poor diet or lack of exercise. Even your genetics can play a role in this. Your ability to break down fats might depend on your genetics to an extent. Heart attacks can be massive, causing someone to go into cardiac arrest or even die. They also can be small. Some people have reported finding out that they had a heart attack that they never even knew they had. There are multiple arteries that feed the heart, so don't think about just one artery as feeding the entire heart tissue. There are multiple of them. So if it happens that there's a blockage in one small little tiny artery feeding a small section of the heart, they could have a small little mini heart attack there and never know it. The problem is that heart tissue will never regenerate again, so someone is at greater risk of having another heart attack, and commonly the follow-up heart attacks that someone has tend to be a lot more severe. Either way, if anyone is showing any type of sign or symptom that they could be suffering from a heart attack, it is a medical emergency. We should coin it as almost a life-threatening emergency, and they should receive advanced medical help immediately to minimize the damage and save the person's life. So how do we identify that someone is having a heart attack? Signs and symptoms can vary from person to person and even be different based off of gender. A person who has previously had a heart attack, like I mentioned, may not even show the same signs that they showed the first time. The classic symptoms that people think about, and they are the most common symptoms that people suffer from, are that persistent chest pain. Now, the chest pain can range from mild to severe. It can also be described as being pressure, tightness, or heaviness. Pain may be difficult to distinguish from heartburn at times, as well as a muscle spasm. Discomfort that radiates into the arms, back, stomach, jaw. Most commonly the left side, so left arm, left shoulder blade, left jaw. Dizziness or lightheadedness. Trouble or changes in breathing. Breathing could be difficult, painful, could be very rapid and fast. Nausea or vomiting. Pale, ashen, or blue skin. The person may be profusely sweating, feel very anxious, or the sense of doom has come over them. Extremely tired or fatigued. And ultimately, they could go unresponsive on you and go unconscious. Men tend to show the classic symptoms, while fascinatingly enough, women typically have a more subtle episode of the classic symptoms. And they showed more general signs and symptoms of just kind of being ill. You can refer to this in figure 3.2 in the course materials. Men's symptoms also typically come on very strong, very fast, whereas women can actually be suffering from the symptoms for days or weeks leading up to the heart attack. Here's just a picture I pulled off of the internet, kind of just showing you some his and her symptoms. So it shows you on the right side, women might complain of the nausea, fatigue, anxiety, loss of appetite, versus men typically have that cardinal, strong, heavy chest pain and tightness in the chest. So what do we do if someone's having a heart attack? So if you think someone's suffering from a heart attack, trust your instincts and call 911. Often people having a heart attack do delay calling because they hope they're just having indigestion, or maybe they're suffering from the flu. But unfortunately, most people who die of heart attacks die within the first 2 hours of symptoms. Heart attacks aren't always fatal, but more advanced help is always needed. It's really important for someone who has suffered from a heart attack to have follow-up, to figure out what they can do to decrease the risk of this happening again and get the care that they need. If you think someone is having a heart attack, you should, as I mentioned, call 911 immediately or have someone else call. Never transport the person to the hospital yourself. This is definitely a situation where it is much better and it's a lot safer to go ahead and call 911. Have the person stop what they're doing. For example, they might be exercising. Have them stop that exercise, take a seat, maybe prop their feet up, and try to get them to rest comfortably. They also might feel like their clothing is being really restricting and giving them that tightness feeling. So have them loosen any tight clothing. Reassure and keep the person really calm. The more someone gets themselves worked up, the harder their body has to work to react to that anxiety. So remember to remain calm yourself. And by remaining calm yourself, you should help calm the person as well. If the person has a past medical history and takes meds, offer to locate that medication for them so that they can take it if that is applicable. So, if they have medication that they're supposed to take, if they start to show signs, you can get that for them and they can take it. If you have a person who is fully responsive and is able to chew and swallow safely, you can offer aspirin, and you can offer 2 low-dose aspirin tablets. If you refer to box 3-1, this will give you a lot more information regarding offering aspirin. It's really, really important to understand that there are going to be situations in which you do not give someone aspirin. For example, if someone's allergic to aspirin, they shouldn't take it. If someone has a known stomach disease or ulcer, they should not take it. If they're already taking blood thinners, you should not have them take the medication. Also, they may have been told by their physician or provider that they should never take aspirin. So make sure you're ruling out all of those things before you're offering it, as well as you are only offering the medication to someone to take. You are not yourself administering this medication into someone. Next, you can closely monitor the person for any changes and be prepared ultimately to administer CPR and the use of an AED. So when you have someone call 911, if you're in an area where an AED might be available, have them go and grab the AED as well. But if you do have a person who's suffering from the heart attack symptoms, if they are fully alert, you might want to do this request of the AED and having the AED arrive kind of privately. It could set off an alarm in their head and cause a lot more anxiety if they see that AED arrive. But consciously in your own mind, be prepared for that situation because it could happen. This kind of reinforces the don't transport the person, because it is very possible that the person could go unconscious and need CPR and an AED. And if you're driving in a vehicle and a person's in the back and they go unconscious on you, you're not going to be able to easily give them care. The ambulance will have an AED, so they'll be able to administer much more advanced help. So that's a heart attack. So understand that a heart attack is different from cardiac arrest. A heart attack is the blockage of the arteries, feeding the heart, creating a decrease in the amount of oxygenated blood that the heart tissue itself is receiving, and ultimately causing that heart tissue to die. Cardiac arrest, on the other hand, is when the heart actually stops beating or the beat is too inefficient to circulate blood to the body. So we call these arrhythmias. So either the heart is stopped or it has an arrhythmia that is so irregular that the heart isn't circulating blood properly. The heart has special cells. Again, like I mentioned, this is not an anatomy class, but just to help you understand a little bit, your heart has these cells in it that conduct electrical impulses, causing the heart to contract. So it's your own inner electrical system that just tells your heart that it has to beat. Great thing, you don't have to think about telling your heart to beat, right? So it is built in to tell your heart to beat. However, that electrical system can get thrown off and create for irregular, chaotic beats. As I mentioned before, an arrhythmia. Causes of cardiac arrest. There are multiple reasons why someone's heart could stop. It is not just a heart attack, even though a heart attack could lead to cardiac arrest. It could be cardiovascular disease. The cardiovascular disease could lead to the heart attack, which could lead to the cardiac arrest. It might be some type of congenital heart condition that the person has. It could be a breathing emergency. Yes, someone who is choking, if they're choking and they don't receive help and they're not getting any oxygen into their body, ultimately they're going to fall unconscious, and if they still aren't receiving any help, their heart is going to stop because their body's not getting any oxygen into it. Severe trauma to the chest, trauma to the head, all of these things could be reasons why your heart could stop. Being electrocuted, being shocked, and drug and alcohol overdoses can all, and as well as medication overdoses, can cause for the heart to stop. Although ultimately cardiac arrest is more common in adults, it does occur in young people. It's not just going to be your elderly people whose heart's going to stop. In younger individuals, most commonly it's a result of a congenital heart condition, and sometimes it's a condition they don't even know they have. In athletes, a lot of times, you've probably heard of athletes collapsing and dying. It's typically from a heart condition that they had that they were unaware of. A breathing emergency, you have the infant who is choking and doesn't receive any help and goes into cardiac arrest. Or trauma is also another common reason why in younger people they have cardiac arrest, as well as I'll follow that up with drug and alcohol overdoses. When the heart stops beating properly, the body will no longer survive because it's not receiving oxygenated, nutrient-rich blood. The heart, is the center at pushing out this oxygenated blood. Deoxygenated blood comes into the heart, it pushes it to the lungs, it grabs oxygen, it goes back to the heart, and then ultimately the heart pumps it out to every single cell into the body. So the heart is a very, very, very important organ. Without oxygen, the brain you will start to have brain damage, and it can begin within 4 to 6 minutes. After about 8 to 10 minutes, that brain damage is virtually irreversible. So you can see just within a few moments, the person can go from being revived to not being revived. Death typically occurs within minutes. So you can think about that 4 to 6 minutes to 8 to 10 minutes. In about 10 minutes, the person will die if they don't receive any help, if they are in cardiac arrest. Signs and symptoms of cardiac arrest. Cardiac arrest is pretty easy to identify. You might be there from the start, so you might witness a sudden collapse in someone. The person will be unconscious and unresponsive. And there will be no breathing or infrequent gasping. We call this agonal breathing. Agonal breaths are not real, true breaths. They are this infrequent gasping of breath. So what is sudden cardiac arrest? Sudden cardiac arrest is simply just suddenly going into cardiac arrest without any warning. So there's no history, or the person wasn't suffering from a heart attack and then went into cardiac arrest. It is that sudden collapse out of nowhere. And as I mentioned a few minutes ago, this does happen in athletics. You see the football player just collapse, or you hear the story on the news about the athlete who doesn't wake up the next morning. It just suddenly out of nowhere with no explanation. That's what sudden cardiac arrest is. So what's the care that we provide for cardiac arrest? So when a person is experiencing cardiac arrest, quick, rapid response is essential for the best chance of survival in this person. The cardiac chain of survival is 5 actions. When performed in a rapid succession, the person's chance of survival increases. Each link or stage of the cardiac chain of survival depends on and is connected to the other stages. As lay responders, you serve a really important link in initiating the cardiac chain of survival. As mentioned previously, without people like first responders and lay responders, that person might never receive care because you didn't recognize the emergency. 4 out of 5, just a fun fact, 4 out of 5 cardiac arrest cases do occur outside of the hospital. You'll be responsible for completing the first 3 links of this chain. It's really important that you do understand and know all of the links of the chain. You will be quizzed on this. This will be exam material. If you think someone is in cardiac arrest, have someone call 911 and retrieve an AED immediately, administer CPR, and begin using an AED as one becomes available. So this shows you the entire cardiac chain of survival, and they have now split them into a adult cardiac chain of survival and a pediatric cardiac chain of survival. This is the newly revised version of it, and in box 3-2 in your text, you'll see the adult as well as the pediatric cardiac chains of survival, and I will reinforce that this is really important information for you to know. So step 1, and it does go in order, and it needs to be in order, is early recognition of cardiac arrest. So you identify that the person is suffering from cardiac arrest and you activate EMS, whether that's calling 911 or calling the designated emergency number that you're going to call. Number 2 is early CPR, so being able to circulate that oxygenated blood to the brain and other vital organs of the body will help keep the person alive. Step 3 is early defibrillation, the use of an AED. You're going to learn this in a few, but the AED can actually restore a normal heart rhythm in the person. Step 4 is early advanced life support, which is provided by the EMS personnel at the scene and en route to the hospital. And step 5 is the integrated post-cardiac arrest care. So basically a team of multiple medical professionals working together to diagnose and treat the cause of the person's cardiac arrest once the person has been resuscitated. So as I mentioned, make sure you know the 5 steps and make sure you know the 5 steps in order. The pediatric cardiac chain of survival is just slightly different. So with the pediatric, because in most cases of peds having a cardiac arrest situation can be prevented, step 1 is actually prevention. So often it's preventing the drowning situation, preventing the choking situation, or preventing them from being electrocuted. I just heard a story the other day where cell phone chargers that are plugged into a wall are a huge risk because children and infants are putting that wire in their mouth, which is directly connected to the outlet. So something that you don't always think about. It then follows through in suit like the adult did. So early CPR, early activation of EMS. So we're going to talk about it, but in a pediatric case, you will care first and then call. But like I mentioned before, if those can be done simultaneously, they should be done simultaneously. Step 4 is early advanced life support. And this will include sending a special pediatric unit. When applicable in certain areas, they can send a pediatric life support unit instead of just your standard ambulance. And then lastly, as mentioned before, it's the interdisciplinary team of medical professionals that are going to work together to figure out the cause of this and how to treat the person further after they've been resuscitated. So make sure you do know the differences between the two cardiac chains of survival. All right, we're finally getting to it. It's the hands-on stuff that you've been waiting for. CPR, okay? CPR stands for cardiopulmonary resuscitation. Why? Well, because CPR is taking over essentially the job of the heart and the lungs. Cardio is heart, pulmonary is lungs. This is the skill that we're going to use to keep oxygenated blood circulating to the brain and other vital organs until more advanced help can arrive. It's a common misunderstanding that CPR is there to restart the heart. It is not very likely that CPR is going to bring the person back to life. But it is a very, very important skill because it has been proven to be able to circulate the oxygenated blood, keeping, like I mentioned before, the brain and other vital organs alive. CPR consists of 30 chest compressions followed by 2 rescue breaths. And yes, the 30 compressions come before the breaths. When you give a compression, you are ultimately squeezing the heart between the spine and the breastbone, pushing blood out of the heart and up to the brain. The rescue breaths are to allow you to deliver oxygen into the person's lung for a fresh supply. And as I mentioned above, cardiopulmonary, so you're taking over the person's lungs and heart. Although full CPR, as I mentioned, is preferred, so full CPR would be your 30 compressions and your 2 breaths. You are allowed to administer what's called hands-only CPR if you are unwilling or unable to give you rescue breaths. And a lot of times, hands-only CPR is taught to many people who don't actually receive any certifications, so that people know basically how to at least administer effective compressions. It's been shown that the person, once they fall unconscious, actually have a decent amount of oxygen in their body to sustain them for about 10 minutes. So if you do administer hands-only CPR, there is a sufficient amount of oxygen in the blood, but as mentioned before, it is preferred that you do 30 compressions to 2 breaths, and that's what we are going to do in this class. An AED. So while I said CPR is important, an AED can actually restart and correct that heart's abnormal electrical rhythm or arrhythmia, which could have been the cause for the cardiac arrest. The 2 most common that we're going to talk about in terms of arrhythmias are VFib or ventricular fibrillation and VTAC, which is ventricular tachycardia. These can both cause cardiac arrest. Just so you understand a little bit from an anatomy standpoint, the ventricles are the bottom portion of the heart. So if you were to take the heart and split it top to bottom, there's 2 chambers in the top which receive the blood, and then there's 2 chambers in the bottom that receive the blood and then push that blood out to the rest of the body, and those are the ventricles. So if you think about it, those are really the meat and muscle which are pushing that blood out. So if they go into what's called fibrillation or an abnormal rhythm, you can see where that can be really detrimental. In VFib, the heart simply does what we call fibrillates, or you can think of it almost as quivering instead of creating a strong contraction. And VTAC, or tachycardia, is when it's moving too fast. So the heart is pumping and the ventricles are just contracting way too rapidly. In many cases, an AED can correct both of these arrhythmias, so it's really important to get an AED to the scene as quick as possible. So what happens is the shock that an AED delivers stops that abnormal rhythm. It basically stops everything and then allows the heart to spontaneously reset on its own. So I tell people it's almost like hitting your circuit breaker in your house. Okay, so you flip the circuit breaker, you give it a second, and then you flip it back on, and everything turns back on again. Okay, so you can kind of think of it that way. Starting CPR and then the use of an AED do give the person the greatest chance of survival. As mentioned before, for every minute CPR and the use of an AED is withheld, the chance of survival goes down by 10%. So administering CPR, and you'll get the chance to spend a lot of time on this in class because I really want to make sure that you all are able to perfect this skill by the time the 8 weeks are concluded. But administering CPR, so after you have checked the person and you have determined that they are unresponsive and not breathing, okay, so we've got to start putting all the pieces together. Check, call, care. Okay, so we've checked the scene. We've checked the victim. We've determined our victim is unresponsive, so we have called and told someone to get an AED, or we have called and put EMS on speakerphone. You should immediately, once you've determined that your victim is unresponsive and not breathing or breathing, having agonal breathing, you should immediately begin CPR. You're going to start with your compressions. And you can find all of these under your skill sheets 3-1, 2, and 3. These will give you great step-by-step directions on CPR. Also, table 3-1 will summarize the key differences between adult, child, and infant CPR. So we'll start off with adult CPR. So as I mentioned before, after you've checked your person and you've determined that they need CPR, you're going to make sure that you have them on a firm surface and they're on their back. You're going to next kneel next to the person, and you probably have already done this because in your check you should have looked, listened, and felt for breathing, correct? So next you're going to place and position your hands. Place the heel of one hand near the center of the sternum, which is the breastbone that some people think of. Place the other hand interlocking the fingers on top of that hand. You want to make sure that your pressure is really coming from the heel of your hand and not your fingers. So you want to make sure those fingers are off the chest. Now in some cases, and I want everyone to try the interlocking version when we get there, but in some cases people have wrist injuries or wrist pain or arthritis in their wrist and they're unable to do this technique. There's also an alternate technique where you're going to put one hand on the chest and then grasp the wrist with the other hand. And in class I will be sure to show you both of these different hand positions. So giving the 30 compressions, what you're going to want to do is lean forward so that your shoulders are positioned directly over your hands. Your arms should always remain straight, and you're always going to want to use the entire body weight to press directly down on the chest. In an adult, you need to press at least 2 inches. Now everyone's like, how do I know if I'm going down 2 inches? I will tell you, because I've practiced on more advanced mannequins before, it is harder and deeper than you think you need to push, okay? So if you think you're pushing hard enough, you probably need to push a little harder. I also tell people that it is not uncommon for ribs to break. So as creepy as it sounds, if you're hearing some snap and crack and pop sounds, you're probably doing the compressions correctly. Also, I'll demonstrate in class, but I'll reiterate using your entire body. If you give compressions only from your arms, you are going to tire very quickly. Next, you want to make sure that once you compress down, when you recoil your hands back up, you want to make sure that chest is coming all the way back up to the normal position before you press down again. If you press down and then you don't let your hands to come up all the way and the chest to rise all the way, you're not going to allow it to fill back up with blood so that you can push it back out again. You're going to want to push hard and fast. They estimate that you should do about 100 compressions per minute. That's a lot. A lot of times people will say you're actually going to give compressions at a rate of the song Staying Alive. And I'm going to show you a video a little later that demonstrates that. You want to make sure that you count out loud and making sure that you're to keep your same rhythm. One tip I always mention is compress on the number and recoil on the and. Keep track of your compressions and your recoil. So for example, you're going to press 1, recoil and, press 2, recoil and you're going to continue with this. Don't allow your hands to bounce off of the chest. They really should remain in contact with the chest for the entire 30 compressions. Incorrect body position will result in you tiring very quickly. I think I mentioned this before when I said reasons that you can stop care is you become too exhausted to continue. CPR is really tiring and really taxing on someone's body, so it's best that you perform it in the most optimal body position as possible to keep yourself from tiring too quickly. So once you've administered your 30 compressions, you can administer 2 rescue breaths. You're going to position yourself at the person's head. You're not getting up from the position. You're just going to slide your torso towards the head of the person. You're going to perform a maneuver called the head tilt chin lift maneuver, which is going to open the person's airway. What you're going to do is place one hand on the person's forehead and 2 to 3 fingers under the chin, tilting the head back and lifting the chin up. If you refer to table 3, you'll see more details on how far to move the head. Using your CPR breathing barrier, create a seal over the mouth and pinch the nostrils, closing off the mouth. Take a breath and expel approximately 1 second worth of breath into the victim and stop breathing as soon as you see the victim's chest begin to rise. Take another breath and repeat that breath again. Now, I don't get caught up on the 1 second, even though you do need to know that for test purposes. You really should breathe only until you see or feel that chest rising, and I'll demonstrate that in class a little better. Remember, you could be caring for someone who is much larger than you, so you might have to breathe a little more than you think you might, or opposite of that, you might be breathing into an infant or someone who's very small, and it might not take much to fill those lungs with some air. Once you've completed your 2 breaths, which should take no longer than 10 seconds, reposition yourself for another 30 compressions. What you're going to do is you're going to continue to repeat cycles of 30 compressions to 2 breaths. And you're going to do so until the person shows obvious signs of life. Maybe they begin to move an arm, begin breathing on their own. Like I said, this isn't common, but it can happen. An AED is ready to use, and no one else is around to help set it up. Now, we'll talk about it a little more with AED, but if there is a second responder there, the person who has delivered the AED, they can begin opening the AED and preparing the AED while you continue CPR. That's the most optimal thing to do. However, maybe the person who arrives and brings the AED is really frantic and panicked and they don't know what to do. You should begin using the AED as soon as possible. You have performed 2 minutes of care. So with CPR, you're going to perform 30 compressions to 2 breaths 5 times. This is 5 cycles in 2 minutes. You can then reassess the situation at that point in time. Most likely nothing has changed, but you can give yourself a 10-second breather and then start back at another 5 cycles again. If possible, if there's another rescuer around who knows CPR at that point in time, it's a great time to have them take over. And you can work together taking over for each other after every 5 cycles. Remember, EMS isn't going to arrive in 2 minutes. Okay? In some cases, it might be 10. In some cases, it might be 15. Okay? So you could be there a really long time providing CPR. Also, continue CPR until EMS personnel arrives and takes over for you. You are alone and you become too tired to continue, or the scene becomes unsafe. So how does CPR for a child and infant change from that of an adult? It actually is really similar. There used to be many differences years ago, but they have basically found that everything should be done the same. Really, the biggest things that change is for a child, they refer to tilting the head back to a slightly past neutral position, versus an adult, they refer to doing a head tilt past neutral. And we'll kind of talk about those subtle differences. Also, in a child, you're going to compress the chest to about 2 inches instead of at least 2 inches. Don't you love that wording they use? But at least or about. For smaller children, you may need to change your hand positioning, so ultimately you will do the interlocked hands over the chest. However, in the case of a smaller child, you can use one hand on the chest and one hand on the head, forehead, maintaining that head tilt chin lift. For an infant, it is also generally the same. The biggest differences here are infants are much smaller, and you're going to provide your compressions with 2 to 3 fingers on the chest, while one other hand remains on the forehead. You're going to compress using the pads of your fingers to a depth of about 1.5 inches. And you're only going to tilt the head to a neutral position and place your mouth over the nose and mouth when giving a rescue breath. So people usually ask, how do you know age differences? So anyone that is 12 years or older should be cared for like an adult. Now, with that being said, they are a minor, but the care is just of that as an adult. A child is anyone ranging from 1 to 12, and an infant is anyone younger than 1. So you can see in the case of a child, the 1-hand compression versus 2-hand compressions. A 10-year-old may need interlocked hand compression versus a 2-year-old might not. So you're going to have to make those decisions on your own whenever and if ever you're in that situation. I really, really, really strongly encourage reviewing, and I hate the terminology memorizing because I don't want you to just memorize and spit things off verbatim and not understand them. But make sure you really know and understand Table 3-1, as well as your skill sheets 3-1, 2, and 3. It's really important for you to review these prior to class, because we're going to dive right into these skills and learning how to actually perform CPR. So some special situations that might arise, and specifically during rescue breathing, and this is under Table 3-2. But the breaths don't make the chest rise. Okay, so we'll say that you just gave 30 compressions and you administered your first rescue breath. Well, when you gave that first rescue breath, the chest didn't rise even though you gave a bigger breath than you thought you needed to. You're never going to give more than 2 rescue breaths. So if after that first one doesn't make the chest rise, go ahead and re-tilt the head. So re-tilt, bring down, and then reset your head tilt chin lift to ensure an open airway. And make sure you have a really good seal around the mouth. A lot of people are afraid to, really create a good seal around that mouth. And then try that breath again, okay? If the second breath does not cause the chest to rise again, you don't need to give another one, okay? What you're actually going to assume is the victim has an object blocking their airway. So the only thing you're going to change in your care that you provide is one slight modification. Is after you give 30 compressions, you're actually going to open the victim's mouth, look for an object before you give 2 breaths. If at any point in time you see an object, you're going to go ahead and sweep that object out with a finger. But beware, you never stick your finger in the person's mouth unless you see something. Because what can happen is the object could be really far back that you didn't see it, but then you pushed it further back down into their throat. And if you see the object but you can't get to it safely without pushing it further down, then you should not remove it. And be sure that you're wearing gloves when you perform this maneuver. Also, if the person vomits, unfortunately this does happen. If you are caring for a person and they vomit, you will need to roll them onto their side. You will need to, using a gloved hand, clean out their airway because you don't want them to now begin choking on the debris. You will roll the person back over and you will resume care. So you can see where gloves and a face shield come in handy in this situation. Anyone have any idea why someone might vomit in the midst of providing CPR? So most commonly, the reason why someone vomits is you have administered too much breath when you administered your rescue breath. So what happens if you breathe too hard into someone, that air is going to escape into their stomach, and then they're going to immediately vomit back up, okay? So this is why it's really important that when you give a breath, you only do so until you begin to see that chest rise. Next is a mouth-to-nose breathing. So you only do this if you're unable to form a seal around the mouth due to an injury. So with one hand, you're going to place that over the mouth, trying to create closing that mouth off. Make sure you do so with a gloved hand. As I mentioned, this is most likely an injury, so there could be a lot of blood in that situation. Next, you're going to create a seal over the nose and breathe using your same principles as before, approximately 1 second or until the chest rises. Understand, you do typically need to breathe a little harder when you're breathing into the nose alone and not the mouth. If a person has a stoma, okay, reveal the stoma. Stoma will be right at the base of their neck. Wipe the area clean. Create a seal with your mouth over the stoma and breathe just like you would normally. Okay, so now using an AED. So we've understand how to administer CPR, but how do we administer an AED? There are many different types. There's a lot of companies out there that have created AEDs. However, they all are very similar. Some have some fancy visual cues. Some have audio prompts. Most all of them do have an audio prompt, but some are fancier than others. If your place of employment has an AED, know where it is located and be sure to make sure it's maintained, or make sure you know who is supposed to make sure that it's maintained. The worst thing that can happen to you is, yeah, you have an AED and you know where it is, but the batteries are not operational, or the AED pads have expired, or better yet, someone used the AED and never replaced the AED pad. So make sure that it is maintained. Take note when you're in a public place the location of an AED. You know, when you walk into a mall, you might see one on the wall. What are some other public places that you may have seen an AED, or you may not have seen one there, but where do you think they're located? So when a person is in cardiac arrest, use the AED as soon as possible. As mentioned before, CPR is doing what? It's circulating the oxygenated blood throughout the body to maintain the body to stay alive, the tissues to stay alive. But it's not restarting the problem. The problem is the heart isn't working. So an AED can actually reset that abnormal rhythm. So it's really important to get using that AED, and that's really why you're seeing AEDs in a lot more places than you did, say, 10 to 15 years ago. Boxes 3-3 and 3-4, as well as skill sheets 3 and 3-4, they're going to provide you with that detailed information you need to know about AEDs, as well as the instructions to using an AED. But do understand that all AEDs are different. So using an AED on an adult. The first step when using an AED is to turn it on. It might sound silly, but people do get caught up in the heat of the moment and forget to turn the AED on and wonder why it's not talking to them. So make sure you turn the AED on. If you haven't done this so far, expose the victim's chest by cutting away any clothing, as well as drying off the person's chest if they are wet. So wipe them off with a cloth. However, never clean the chest with anything that's flammable like an alcohol wipe. You're going to next unpeel the back of one AED pad and stick it. It's like a big sticky sticker. You're going to stick it to the person's upper right side of their chest. Next, you're going to unpeel the second pad and place it on the person's lower left side of their chest. Some AEDs are different, like I mentioned. Some you'll actually need to plug in the pads to the AED with a connector. However, some AEDs, that plug is already attached and you don't need to do so. So make sure that you are aware whether you plugged the AED pads in or not. Some AEDs will analyze the person's rhythm immediately. Some will actually just give you some clues, so they'll tell you to begin CPR, and they'll wait a few moments before they analyze. Some also will require you to press a button before it analyzes. It's really important to understand that no one should be touching the victim when the AED is analyzing. Why is that? You all should be thinking because, well, if you're holding on to a victim and there's an electrical current going through via the AED to read the heart rhythm, it's actually going to pick up your heart rhythm and wonder why you just put an AED on a fully living, normal rhythm, heart rhythm person. Okay? So make sure no one is touching when the AED is analyzing. Next, it's quite possible the AED may advise a shock. If the AED recognizes those heart arrhythmias, it will advise that a shock be administered. This will also require you to press a button again. Be sure, once again, you are not touching the victim when the shock is being delivered. Why don't we touch a victim when the shock is being delivered? I hope everyone is thinking well, because you're going to get shocked as well. Okay, so make sure that you are not touching a victim and no one else is touching the victim when the shock is being delivered. Once the shock has been delivered and it's no longer shocking the victim, and believe me, you'll be able to tell, the shock is going to create quite a jolt that's going to result in the person's body kind of lifting up ever so slightly. You are going to immediately begin CPR again, and the AED most commonly will advise you to do so. Also, the AED might not recognize the rhythm and may not advise a shock. In that case, you will just continue administering CPR. It will want to reanalyze again after a few minutes. And when it does that, be sure that no one's touching. If you notice signs of life, you can leave the AED on, but discontinue CPR. And then you're going to wait for help to arrive. So you can leave the pads on the person. If the person starts to move their arms or legs, or they open their eyes, which we all hope happens, you don't need to administer CPR any longer. AEDs as well, the EMS will want to take the AED with them. They can get information off of the AEDs at the hospital that is helpful. Okay, so using an AED on an infant or a child, you can use an AED on a child or infant. All the basic steps and procedures are the same. Some AEDs will come with what are referred to as pediatric pads. So these pads are smaller in size and should be used on a child and infant under the age of 8, or they're approximating that an 8-year-old weighs about 55 pounds. So under 55 pounds. These pads are designed to fit better because they are smaller, and they will actually deliver a lower level of energy. If pediatric pads are not available, you actually can use the adult pads on a child or infant. However, the opposite is not the same. The pediatric pads are not big enough and won't generate enough energy for an adult. So you should never use pediatric pads on anyone larger than 55 pounds. They have proven that the larger pads and the bigger shock to an infant or a small child is safe. If you cannot position the pads in the upper right and lower left position without the pads risking touching, so you never want the pads actually touching each other, you should place one in the middle of the chest and the other in the middle of the back between the shoulder blades. And we call this the sandwich method. So you're putting one pad on one side, baby in the middle, another pad on the other side. Proceed by using the AED in the same way as you would for the adult. Some other special considerations when using an AED, you can find these in box 3-4. But are some environmental considerations. So flammable materials. So we never want to use an AED around flammable materials. You should all be thinking because, well, you could cause a massive explosion. Metal surfaces. It is okay to use an AED when a person is on metal, so long as the AED pads themselves are not touching the metal. Water, remove the person from the water first and be sure that you and other responders are not in large puddles. Now, it is okay in the event of inclement weather. If you are outside and it's raining, you can use an AED. If you can, it would be advised to try to hold something like an umbrella over the person and the AED. And be sure to dry the person off before placing that AED on them to ensure good contact with the skin. Some other things to consider are pregnancy. It is okay to use an AED on a pregnant person. Pacemakers. So some people with known arrhythmias actually have pacemakers placed in them. Pacemakers are basically an implanted AED. So when the heart begins to kind of go off its normal rhythm and it starts to fall into an arrhythmia, the pacemaker shocks it back into that normal rhythm. If a person is in cardiac arrest, obviously the pacemaker hasn't done its job and it's failed. If the device is visible, now commonly they're seen as a large hard lump under the collarbone on the left side of the chest. You just want to make sure that you don't place the pad directly over the device. Well, if you're supposed to be placing the pad on the victim's lower left chest, there should be no reason for it to ever go over the pacemaker. However, the pacemaker could be implanted into a different area. Just understand that if you can feel or see a pacemaker, don't place the pad directly over it. Chest hair. If the person does have a large amount of chest hair that might interfere, you actually will need to clear off that chest hair by quickly shaving just the area that the pad will go on. Now, a normal amount of chest hair is fine, but I joke, if someone's wearing a wool sweater underneath their sweater and they have a lot of chest hair, you will need to shave that area quickly because the pad isn't going to be in direct contact with the skin. It might interfere with the ability of the AED to read the rhythm of the heart. If anyone has any transdermal medical patches, be sure to remove them with a gloved hand before using an AED. People might have a nicotine patch, as well as some people have nitroglycerin patches that are on their chest. And like I said, make sure you're wearing a glove because you want to make sure that you don't receive any of that medication through direct contact with that patch. And then jewelry and body piercings. You don't need to remove jewelry or any body piercings so long as the pads aren't directly over the metal. Now, it's really important to work as a team. If possible, you want to make sure that CPR is administered with good quality compressions and very limited interruptions. If you're alone, you will begin to tire quickly, like I mentioned before, and you'll have to stop compressions to set up an AED if an AED arrives. If you can work as a team, this will lead to a better chance of survival for the victim who's in cardiac arrest. You'll be able to administer almost a seamless, uninterrupted care. If there are more than 2 rescuers, you should switch every 2 minutes or 5 cycles with CPR. And also when an AED arrives, the one person should completely set up the AED. They can open the AED. They can place the pads on the victim while you are continuously administering CPR. So putting it all together, at this point in time, you have completed all 3 C's. Okay? We've gotten check, call, and care. So you're going to learn even more care situations, but now you know how to care for a cardiac arrest person or someone who's suffering from a heart attack. So I really want you to practice reviewing, putting all the steps together. So think of a scenario. Write down your scenario, and from start to finish, so making sure to bring in chapters 1 and 2, write down from start to finish how you would care for that situation. And make sure you bring this with you to the next class for discussion. You'll find a list of review questions here as mentioned before. Try to answer them without any help. If you're unable to, go ahead and refer back to the PowerPoint as well as the course text to try to answer all of these questions. These questions are important for understanding, for quiz review, as well as exam review. We'll see you soon.